It's me, Dr. Nathan, and you're welcome to Real Heath Revealed. I hope you are sticking to the safety protocols for COVID-19, wearing your mask, washing your hands, and then keeping your distance. Please, let's all take care out there. Today on Real Heath Revealed, we'll be talking about sickle cell disease. We'll talk about what it is, what are the symptoms, and then also what you can do to stay healthy if you have sickle cell disease. So, sickle cell disease is a group of diseases that have to do with an abnormality of the red blood cell. What happens is that the red blood cells become sickle, or they form C's, or they become in the shape of C's. When this happens, they become very sticky and then they can glue up together and then form, clots. When these clots are formed, they can then block blood vessels that lead to various parts of the body. So when someone has sickle cell crisis like we usually hear, that means that these sickle-shaped red blood cells that have formed a clot have blocked a blood vessel to the part of the body where they are feeling the pain. And this is sickle cell disease. It's a genetic disease that is passed on from your parents to the children. So, sickle cell trait. I'll take it from sickle cell disease and then we'll come to sickle cell trait. We said it's a genetic condition. So, with a gene, you have two parts and you get one part from your father and the other part from your mother. These two parts come together to give you the gene. Now, with sickle cell disease, both genes from your parents are abnormal. However, when you have sickle cell trait, you have a normal gene from one parent and then an abnormal gene from another parent. This is the sickle cell trait. It is not a disease, and people who have sickle cell traits do not have any symptoms or do not need to take any of those precautions that sickle cell disease people need to. Now, I mentioned earlier that it's a genetic condition. So it's not something you do or something in the environment that causes it. It's a hereditary thing. It's a genetic thing. So it's passed on from your parents down to you. Two genes come together, or two parts of a gene come together and cause the sickle cell disease. There are different types, and we can have the SS, we can have SC, we can even have CC, or you can have an S with what we call a beta thalassemia hemoglobin. These are the different types. What might differ amongst them is how severe you might present or how severe your symptoms might be on a day-to-day basis. With the SS type, you have very severe disease, and then with the SC and then CC types, it's not so serious. The symptoms are milder. So who is at risk of getting sickle cell anemia or sickle cell disease? Now, it's by no fault of yours if you have it. And anyone who gets it, that means that one or both of your parents had an abnormal part of the gene that can cause sickle cell disease. And each of them gave that abnormal part to you, and then you got the disease. So that is what puts you at risk of developing sickle cell disease. So we have various ways of treating sickle cell disease, and it might come with different sorts of symptoms. Each symptom has a treatment. Sometimes we use pain medication, we use fluids that are put into your vein. We also use antibiotics, and even these days we are using medications that keep your blood thin, so to prevent those blood clots I spoke about much earlier. Now, to cure sickle cell disease, there's new treatment on the horizon, or new treatment that is being used, which is called bone marrow transplant. It's very new, it's shown some success, but then it's being fine-tuned to make sure that a lot of people have access to it and we can have more people cured of sickle cell disease. Let's clear up the myths you have about sickle cell disease. So for most of the time, sickle cell disease can be painful, not all the time. However, it is not a contagious disease. It can't be transmitted like HIV can't be transmitted. Remember, it is hereditary, it's through genetics. So you are born with it. It's not an infectious disease. Nothing at all prevents you from marrying anyone with a sickle cell trait. You just need to be aware of your risks. You also need to know whether you have the trait or not, and then know what you are getting into and the potential of having children with sickle cell disease. But nothing prevents you from marrying someone with sickle cell traits. Sickle cell disease patients can live very long lives. I've met some in their 50s, 60s, and even 70s, and they do not necessarily live up to 21 and die. This is so false. So say you have sickle cell disease and you want to know how to stay healthy. These are some health tips for you. First of all, it's important to make sure you are staying well hydrated. That means that you are drinking lots of water throughout the day and every day. Make sure that you are taking your multivitamins and especially folic acid. Children who are very young to adults in their 50s, 60s all need to be taking folic acid. Also, it's very important for you to keep up with your doctor's visits every 2 to 3 months. Make sure you are seeing a hematologist or a specialist who can help you take care of your sickle cell disease. Another important thing is to avoid getting infections. So making sure you are staying away from people who have colds and other sorts of infectious diseases, because you can easily get ill and then get into crisis when you get such infections. If you are in a cold temperature or cold weather, make sure you are staying very warm. Wear a nice jacket or sweater to keep you warm and prevent crisis from coming up. Remember that you also need to eat healthy and then get enough exercise, as much as you can cope with every single day. I hope this has helped you. So that is it with sickle cell disease. You've learned what it is, what puts you at risk, and then also how to stay healthy if you have sickle cell disease. Thank you for staying till the end. Remember, a new episode drops every Saturday at 12 p.m. GMT. I would like you to like this video, subscribe to this channel so you don't miss out, and then comment in the section below and join the conversation on social media. Remember to stay healthy, guys. See you in the next one.